To relieve a child who is choking, first ask them if they are choking and tell them you will help. Begin with 5 back blows. Stand to the side and slightly behind the child, support their chest with one hand, and deliver 5 firm blows between the shoulder blades using the heel of your free hand. Then perform 5 abdominal thrusts. Stand behind the child, wrap your arms around their body below the rib cage, make a fist just above the navel, grip it with your other hand, and deliver quick upward thrusts. Alternate 5 back blows and 5 abdominal thrusts until the obstruction is relieved, the child can breathe or cough effectively, or the child becomes unresponsive. If you can see a foreign object in the child's mouth and can easily remove it, then do so. Avoid blindly sweeping the mouth with a finger as it may push the object deeper into the airway. Continue CPR until the child recovers or until more advanced help arrives. Large children may require chest thrusts if you cannot wrap your arms fully around their waist. In this case, perform the Heimlich maneuver with your fist on the breastbone. Any child who has had a severe choking event should see a doctor. If the child stops responding, lay them down and yell for help. Check for breathing and begin CPR. After 30 compressions for 1 provider and 15 compressions for 2, open the airway and look for a foreign object. If visible, remove it and attempt to give a breath. Continue CPR until the child recovers or more advanced help arrives.